First of all, I'd like to thank Cancer Care India for inviting us to participate in this conference meeting. And I and my colleague Tenzin are very happy to be here and having met wonderful people in this conference. So I'd like to thank you. And as it was outlined earlier, so actually Bhutan is planning to join the network of Cancer Care India, and we are very happy to be invited to join the Cancer Care India. And since it is our first meeting with you all, so we would make a very brief presentation about the Bhutan Cancer Society. And to do this, I'd like to invite my colleague, Tenzin, please come. Tenzin is the officiating executive director of Bhutan Cancer Society. I'm the chairman of the board of the Bhutan Cancer Society, Dr. Sangay Thinley, and I used to be working with the Ministry of Health previously, and also with the World Health Organization in New Delhi. Thank you.
You can come also. Please come. Please come. I think Bhutan Cancer Society has been organizing SAR conference this year. I think every year they do the SAR conference. And this time, if you want to tell something about the SAR conference, what is the date, and you can invite also.
Hello, good morning. My name is Tenzin Yangden, and I work as the program officer for Bhutan Cancer Society. First of all, thank you, Cancer Care India, and especially Dr. Chaturvedi for inviting us here. It is an honor and a privilege to be here. Because of the time limitation, I'll go through the slides very fast, just a gist of what we do at Bhutan Cancer Society. So Bhutan Cancer Society is a public benefit organization registered under the Civil Society Organization Authority. So BCS was officially launched by Her Royal Highness Aji Kesangwang Mawangchuk on 4th of February, coinciding with the World Cancer Day 2015. So it has been just 3.5 years since we are in operation, and we've achieved quite a lot in this short period of time. The purpose of Cancer Society Bhutan is to promote cancer care and prevention through education, advocacy, and research, to improve access to quality care and support, to provide social, spiritual, psychological, and financial support where needed to people living with cancer. So, Bhutan Cancer Society primarily works under 3 major pillars, that is the care and support for cancer patients and caregivers, cancer prevention and advocacy, and also cancer research. Under care and support, we try and establish network of people battling with cancer, the survivors and the caregivers. We also provide palliative care and support to the terminally ill cancer patients as well as the caregivers, beginning at the diagnosis and continuing through treatment, follow-up, and the end of life. On a need base, we also provide information on nutrition, post-chemo care, counseling to cancer patients and caregivers, in addition to the financial aid that we provide for the cancer patients to avail treatment services in Thimphu and India. So most of the cancer patients are sent to either Calcutta or Vellore for treatment. Under research, we're supporting the establishment of National Cancer Registry. So right now we don't have an exact data of how many cancer patients are there. So we're trying to set up that cancer registry, but we have an approximate number of cancer patients at the moment. So from 2014 to 2017, we have about 2,153 new cases. And we also try to mobilize resources for small research grants for healthcare practitioners. So I'll just take you through some of our work. So this is the World Cancer Day. We celebrate it every year on the 4th of February at the Memorial Chorten in Thimphu. So we offer 1,000 butter lamps and prayers for all those cancer patients who have lost their lives to cancer in the world. This is the breast and cervical cancer awareness program for girls and women in Bhutan. This is the breast and cervical cancer awareness program for nuns in Bhutan. So we are targeting all the groups. We're not leaving anyone behind. This is the head and neck cancer awareness program, then the stomach and esophageal. So this is the project called Compassionate Transition. Under this project, we have nutrition sessions, we have psychosocial sessions, we have yoga sessions, we have spiritual sessions, and we try to create a peer network group where the cancer patients can come together and discuss their issues and give support to each other. So this is the nutrition session. We also provide refreshments during these nutrition sessions for healthy living. This is the Relay for Life. So we celebrated the Relay for Life for the first time this year in June. Given the stigma that currently exists in our society regarding cancer being a death sentence, Relay for Life was our humble effort to raise hope to showcase survivorship in Bhutan. So as a part of event, we brought together all the cancer survivors in the country and celebrated it. So this is the Relay for Life. And in 2016, when we were just about 1.5 years into operation, we were awarded the National Order of Merit by His Majesty the King on 17th December, coinciding with the historic 109th National Day celebration. So being one of the youngest CSOs in Bhutan, it was an honor and a privilege to receive such a prestigious award. Now, as a small, thank you. Just a small information. So the SARC Oncology Conference is going to be hosted in Bhutan this year. It's on the 14th and 15th of this month. So a lot of speakers from SARC countries are coming to Bhutan to talk about their work. Dr. Chaturvedi is also going to be there. This year, Bhutan is hosting the 13th SFO conference. Thank you.